Understanding and managing high blood pressure, hypertension, a comprehensive overview. High blood pressure, also known as hypertension, is a medical condition characterized by elevated blood pressure levels. Blood pressure is measured in millimeters of mercury, mmHg, and consists of two components. Systolic pressure, the pressure generated by the heart during beats, and diastolic pressure, the pressure in the blood vessels between heartbeats. The conventional measurement, expressed as systolic/diastolic, was historically defined as 140/90ths of a millimeter Hg. However, in November 2017, new guidelines in the United States revised the threshold to 130/80ths of a millimeter Hg, leading to a significant increase in the number of individuals diagnosed with hypertension. Categories of blood pressure. Under the current classification, blood pressure is categorized as follows. Normal, less than 120/80ths of a millimeter Hg. Elevated, 120/80 to 129/79ths of a millimeter Hg. Stage 1 hypertension, 130/80 to 139/89ths of a millimeter Hg. Stage 2 hypertension, 140/90ths of a millimeter Hg and above. Importance of monitoring and addressing high blood pressure. High blood pressure is often referred to as the silent killer, because it can be asymptomatic, leading to damage in various organs such as the brain, eyes, heart, kidneys, and arteries throughout the body. Even without noticeable symptoms, hypertension significantly increases the risk of severe conditions like heart attack, stroke, and kidney failure. Symptoms and diagnosis. While hypertension usually doesn't directly cause symptoms, extremely high blood pressure can result in headaches, dizziness, fatigue, or visual disturbances. Accurate diagnosis relies on careful blood pressure measurements, with recommendations including avoiding strenuous activities, smoking, eating, and consuming caffeinated beverages before readings. Two measurements should be recorded and averaged for precision. In case of elevated readings, further examination of the eyes, heart, and nervous system is essential to detect potential damage from hypertension. Risk factors. High blood pressure, or hypertension, can be influenced by a variety of factors, and recognizing these risk factors is crucial for effective prevention and management. Here's an overview of key elements contributing to hypertension. Age. Explanation. The risk of developing high blood pressure tends to increase with age. Blood vessels naturally lose elasticity over time, making them more susceptible to pressure changes. Recommendation. Regular blood pressure monitoring becomes especially important as individuals age, allowing for early detection and intervention. Family history. Explanation. Genetic factors play a significant role in hypertension. If close family members have a history of high blood pressure, there's an increased likelihood of developing the condition. Recommendation. Individuals with a family history of hypertension should be vigilant in adopting preventive measures and undergoing regular blood pressure screenings. Race. Explanation. Certain ethnic groups, including African Americans, are at a higher risk of hypertension. This increased susceptibility may be due to genetic predispositions or environmental factors. Recommendation. Individuals from high-risk racial backgrounds should be proactive in monitoring their blood pressure and implementing lifestyle modifications. Underlying medical conditions. Explanation. Chronic conditions such as diabetes, kidney disease, and sleep apnea can contribute to the development of hypertension. These conditions may affect the body's regulatory mechanisms for blood pressure. Recommendation. Effective management of underlying health issues is essential in controlling blood pressure. Regular medical checkups are crucial for early detection and intervention. Lifestyle factors. Explanation. Unhealthy lifestyle choices, including a diet high in sodium, low physical activity levels, excessive alcohol consumption, and smoking, can significantly increase the risk of hypertension. Recommendation. Adopting a heart-healthy lifestyle, including a balanced diet, regular exercise, moderation in alcohol intake, and smoking cessation, plays a pivotal role in hypertension prevention. Stress and mental health. Explanation. Chronic stress and untreated mental health conditions can contribute to elevated blood pressure. Stress hormones may impact blood vessel function and overall cardiovascular health. Recommendation. Incorporating stress management techniques, such as mindfulness and relaxation exercises, can positively influence blood pressure levels. Emphasizing individual risk profiles. Understanding that each person's risk profile is unique is essential. Some individuals may have a combination of these risk factors, while others may have specific factors that contribute to their hypertension. Therefore, a personalized approach to prevention and management, based on individual health history and lifestyle. Is key to maintaining optimal blood pressure levels and overall cardiovascular health. Regular consultations with healthcare professionals can help tailor strategies for each person's specific needs. Diagnostic tests for hypertension and organ damage. Upon hypertension diagnosis, additional tests may be conducted to assess organ damage, including blood tests for kidney function and potassium levels, electrocardiogram, EKG, to identify heart muscle thickening or irregular rhythms, chest X-ray to detect heart enlargement or fluid buildup in the lungs. Preventive measures. Preventing high blood pressure involves adopting a healthy lifestyle, including regular aerobic exercise, limited salt and alcohol intake, a diet rich in fruits, vegetables, and low in saturated fats, smoking cessation, maintaining a desirable body weight, managing other risk factors for coronary artery disease, such as reducing high LDL cholesterol. Treatment approaches. Treatment varies based on blood pressure levels. Elevated blood pressure, lifestyle changes, including dietary modifications, increased physical activity, weight loss, and limited alcohol consumption, are recommended. Stage 1 hypertension, lifestyle changes are emphasized initially, with medication considered based on individual risk factors. Stage 2 hypertension, medication is typically prescribed in addition to lifestyle modifications. Common antihypertensive medications include diuretics, ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers. Individualized approach for high-risk individuals. Individuals with diabetes, kidney disease, or heart problems are at a higher risk of complications from hypertension. Therefore, they often require more aggressive treatment with medications to manage their blood pressure effectively. Medication overview. Navigating antihypertensive treatment. Common antihypertensive medications. Diuretics. Mechanism: increase urine production, reducing fluid volume and blood pressure. Examples: hydrochlorothiazide, furosemide. Considerations: monitor potassium levels, may increase urination. ACE inhibitors, angiotensin converting enzyme. Mechanism: relax blood vessels, lowering blood pressure. Examples: enalapril, lisinopril. Considerations: may cause a persistent cough, monitor kidney function. ARBs, angiotensin receptor blockers. Mechanism: block the action of angiotensin, dilating blood vessels. Examples: losartan, valsartan. Considerations: well tolerated, monitor kidney function and potassium levels. Calcium channel blockers. Mechanism: relax blood vessels by blocking calcium influx. Examples: amlodipine, diltiazem. Considerations: may cause ankle swelling, monitor heart rate. Beta blockers, alpha blockers, and combination medications are additional options with distinct mechanisms. Importance of medication adherence. Consistent usage. Benefits: adherence ensures the medication's effectiveness in controlling blood pressure. Reminder tools: use pill organizers, alarms, or smartphone apps to stay on schedule. Communication with healthcare providers. Regular follow-up, schedule routine checkups to discuss medication effectiveness and potential adjustments. Side effects: report any unusual side effects promptly. Complications of hypertension. Hypertension, if left untreated or poorly managed, can lead to a myriad of serious complications that extend far beyond high blood pressure. Understanding these potential risks is essential for individuals to grasp the importance of effective hypertension management. Here's an in-depth exploration of the complications associated with chronic high blood pressure. Coronary artery disease, CAD. Explanation: untreated hypertension significantly increases the risk of developing coronary artery disease. Elevated blood pressure can lead to the accumulation of plaque in the arteries, restricting blood flow to the heart. Impact: reduced blood flow to the heart can result in angina, chest pain, and, in severe cases, may lead to heart attacks. Heart failure. Explanation: chronic high blood pressure puts added strain on the heart, causing the muscle to thicken and weaken over time. This condition, known as hypertensive heart disease, can eventually lead to heart failure. Impact: heart failure occurs when the heart cannot pump blood effectively, resulting in symptoms such as fatigue, shortness of breath, and fluid retention. Peripheral arterial disease, PAD. Explanation: hypertension contributes to the development of peripheral arterial disease by narrowing and hardening the arteries that supply blood to the legs and arms. Impact: PAD can lead to pain, numbness, and impaired mobility. In severe cases, it may result in tissue damage and even amputation. Kidney damage. Explanation: the kidneys play a crucial role in regulating blood pressure. Chronic hypertension can damage the small blood vessels in the kidneys, impairing their ability to filter waste and excess fluids. Impact: kidney damage can progress to chronic kidney disease, CKD, and, ultimately, kidney failure, necessitating dialysis or transplantation. Vision impairment. Explanation: hypertension can affect the blood vessels in the eyes, leading to retinopathy. This condition can result in damage to the retina and potentially lead to vision loss. Impact: vision impairment may range from subtle changes to complete blindness. Highlighting the importance of regular eye examinations for individuals with hypertension. Cognitive decline. Explanation: chronic high blood pressure has been associated with an increased risk of cognitive decline and dementia. The exact mechanisms are complex but may involve reduced blood flow to the brain and damage to small blood vessels. Impact: cognitive decline can manifest as memory loss, difficulty concentrating, and, in severe cases, conditions like Alzheimer's disease. Lifestyle modifications for blood pressure management. Beyond dietary adjustments and regular exercise, several lifestyle factors contribute significantly to blood pressure regulation. Recognizing the interconnectedness of these elements is crucial for comprehensive hypertension management. Here's a detailed guide on lifestyle modifications to promote overall cardiovascular health. Stress management techniques. Mindfulness and meditation. Explanation: practice mindfulness meditation to cultivate awareness of the present moment, reducing stress and promoting relaxation. Impact: mindfulness techniques have been shown to lower blood pressure and enhance overall mental well-being. Deep breathing exercises. Explanation: engage in deep breathing exercises to activate the body's relaxation response, mitigating the effects of stress hormones. Impact: deep breathing helps reduce anxiety and stress, contributing to improved blood pressure control. Adequate sleep. Explanation: prioritize quality sleep by maintaining a consistent sleep schedule and creating a conducive sleep environment. Impact: sleep plays a vital role in regulating stress hormones and supporting overall cardiovascular health. Aim for 7 to 9 hours of uninterrupted sleep nightly. Social connections. Build and maintain relationships. Explanation: foster positive social connections with friends, family, and community. Impact: strong social ties contribute to emotional well-being, reducing stress and promoting healthier blood pressure levels. Join social activities. Explanation: engage in social activities, clubs, or support groups to enhance a sense of belonging and connection. Impact: social interactions provide emotional support, which can have a positive impact on mental and cardiovascular health. Limit social isolation. Explanation: avoid prolonged periods of social isolation and loneliness. Impact: social isolation has been linked to increased stress and higher blood pressure. Regular social interactions offer a protective effect. Regular physical activity. Cardiovascular exercise. Explanation: include aerobic exercises such as walking, jogging, swimming, or cycling in your routine. Impact: regular cardiovascular exercise improves heart health, enhances blood circulation, and aids in blood pressure control. Strength training. Explanation: integrate strength training exercises into your weekly regimen. Impact: building muscle mass contributes to overall metabolic health, supporting weight management and blood pressure regulation. Hydration. Explanation: maintain adequate hydration by consuming an appropriate amount of water throughout the day. Impact: proper hydration supports optimal blood volume and helps regulate blood pressure. Limit alcohol and caffeine. Explanation: consume alcohol and caffeine in moderation, as excessive intake can contribute to blood pressure elevation. Impact: moderation in alcohol and caffeine consumption helps maintain healthy blood pressure levels. Tobacco cessation. Explanation: quit smoking and avoid exposure to secondhand smoke. Impact: smoking increases blood pressure and damages blood vessels. Quitting smoking has immediate and long-term benefits for cardiovascular health. Dietary recommendations for blood pressure management: embracing nutrient-rich foods. Potassium-rich foods. Explanation: potassium helps balance sodium levels, promoting healthy blood pressure. Food sources: bananas, oranges, potatoes, spinach, avocados, beans, and yogurt. Meal idea: breakfast, Greek yogurt with sliced bananas and a sprinkle of almonds. Calcium-rich foods. Explanation: Adequate calcium supports blood vessel health and helps regulate blood pressure. Food sources: low-fat dairy products, fortified plant-based milk, leafy green vegetables, and tofu. Meal idea: lunch, grilled salmon with a side of sautéed kale and quinoa. Magnesium-rich foods. Explanation: magnesium plays a role in blood vessel relaxation, contributing to blood pressure control. Food sources: almonds, spinach, whole grains, legumes, and dark chocolate, in moderation. Meal idea: snack, trail mix with almonds, sunflower seeds, and dark chocolate. Heart-healthy diet. Explanation: the diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, all of which contribute to blood pressure management. Sample day. Breakfast: oatmeal with berries and a side of Greek yogurt. Snack: apple slices with almond butter. Lunch: quinoa salad with mixed vegetables and grilled chicken. Snack: carrot sticks with hummus. Dinner: baked salmon with steamed broccoli and brown rice. Exercise guidelines for optimal blood pressure control: a balanced approach. Aerobic exercise. Frequency: aim for at least 150 minutes of moderate intensity aerobic exercise per week or 75 minutes of vigorous intensity exercise. Examples: brisk walking, jogging, cycling, swimming. Tip: break down sessions into 30-minute segments most days of the week for consistency. Resistance training. Frequency: include strength training exercises for all major muscle groups at least 2 days per week. Examples: weightlifting, bodyweight exercises, resistance band workouts. Tip: gradually increase resistance to challenge muscles and enhance overall fitness. Combined exercise. Integration: incorporate a blend of aerobic and resistance exercises for a comprehensive workout routine. Examples: circuit training, high-intensity interval training, HIIT. Tip: vary exercises to keep workouts engaging and accommodate different fitness levels. Flexibility and balance training. Inclusion: integrate flexibility exercises, for example, stretching, yoga, and balance training into your routine. Benefits: enhances overall mobility, reduces injury risk, and supports cardiovascular health. Tip: include stretching at the end of each session to improve flexibility. Daily activity integration. Lifestyle movement: incorporate physical activity into daily routines. Examples: take the stairs, walk or bike to work, stand while on phone calls. Tip: make physical activity a habitual part of your day to enhance overall cardiovascular health. Your health matters. Quali.health